Hello viewers, my name is Dr. Shola Akini, consultant gynecologist at True Care Fertility Clinic, Lagos. I want to welcome you all to this live discussion on vaginal discharge, and I hope we're keeping safe from this coronavirus pandemic. So I'll start by way of introducing this topic, which is very important, and I believe that the objective of providing information, usable information to our female folks, our parents, and the little girls will be achieved at the end of the session. Vaginal discharge is a common complaint by girls and women, especially girls after puberty. Before puberty, because of the lack of estrogen before puberty, vaginal discharge is less common, but common from puberty up until menopause. That is from about the age of 17 to about the age of 44 years, which is the active reproductive life age bracket. Now, our women are well endowed, and all the things that we're going to discuss today will be discussed with all respect, utmost respect to womanhood. So when I use terms, I am using those terms with utmost respect to womanhood. The vagina is uniquely located as a gateway between the external environment and the internal environment. It connects from the outside, which is the vulva, which is called the vulva, through a tunnel, which is the vagina proper, to the neck of the womb. And from the neck of the womb, it connects to the body of the womb, that is the womb cavity. And from there, the tubes connect to the inner area of the pelvic cavity, that is the hip region. Now, therefore, it means that germs can pass freely from outside to inside and vice versa. This is one reason why females are different from males. That is the first point to note. The second point is that unlike in females, the entrance to the vagina is crowded by the pubic hair, and as is common sense, when you have hair grown around a region, they tend to trap dirt, they tend to trap organisms, including germs. So the vagina is covered at the vulva by pubic hair in the private parts. This is the second point. So, again, unlike what we have in males, the outside of the vagina, which is the vulva, at the below the vulva is the anus, where there is always physis, that is, there could be poo-poo and all around the anus, and which is situated right behind the vulva. And at the top of the vulva, there is the urethra, which brings urine to the exterior, which means, therefore, that when a woman urinates, the urine can dribble down into the vulva and then into the vagina. So if you look at these two scenarios, therefore, it is easy for a woman to smear the vulva with urine, and from the vulva it goes into the vagina. So also, it is easy for a woman to poo-poo, and in the act of cleaning up, cleans from behind forward, which means that she could end up smearing the vulva with physis. Now, having said this, why is vaginal discharge common in the age bracket of 18 to 44 years? Now, like I said before, puberty, the estrogen hormone is low, and after menopause, also there is low estrogen state. Now, estrogen is a hormone that is unique with women, and what it does is that it participates in so many of the unique features, including body and functions of a woman, that differentiate them from a man. So let us therefore talk briefly about what a secretion should be. There are two types of discharges, of vaginal discharge. The first one, that conforms to the body form and function of a woman, is said to be physiological. That is, it is harmless. The second one is said to be pathological. That is, it's a disease. Now, in the genital tract of a woman, there are secretions from the womb, that is the lining of the womb. The lining of the womb contains glands, and this secretes fluids. And the cervix also has secretions, mucous secretions from the cervix. The vagina itself does not secrete glands, but it is covered with cells. That is, they are called vaginal epithelium. These cells do not have glands, but they are covered by watery fluids from the secretions from the glands of the cavity, that is the womb cavity, endometrial glands, mucous secretions from the cervical glands, and two glands on either side of the vulva, that is at the outside of the vagina, called Bartholin's glands. And this joined together forms the physiological fluid. Of course, they contain cells that are shed from the cervix and the vagina, and some chemicals, including especially lactic acid. Now, why lactic acid? The cells, the estrogen in women encourages the cells of the vagina to be loaded with glycogen, and the vagina contains organisms, especially when I say organisms, I mean germs, harmless and harmful. One of the harmless and most common in the vagina is called lactobacilli. They convert the glycogen in the cells of the vagina into glucose, and from glucose to lactic acid. So lactic acid is therefore, as it were, a natural defense of the vagina, and that is why in a normal physiological state, vaginal infection and vaginal discharge should be rare. That is, if this natural defense of the vagina is in proper place. So what I have said now is that the vagina connects the outside with the inside of the woman, and there are secretions that come from the womb to the neck of the womb, and the covering the vaginal cells, and then also secretions from the Bartholin's gland, found one on each side of the outside of the vagina. Now, so the natural defense of the vagina first is that the vagina is usually closed at the vulva, and that means that some things cannot pass through the vagina except the vagina is open. The second is that God has made it in such a way that the vagina itself produces acid, which is lactic acid, and you know that lactic acid is harmful to many organisms. So what it does is to allow the growth of certain organisms which largely are harmless to the vagina, and disallows the growth of some harmful organisms that are harmful to the vagina, which means that this is a natural defense as made by God. So the pH of the vagina is usually between 4 and 4.5, and this is unique to womanhood in that the vagina is able to defend itself under normal circumstances. So there is this vaginal ecosystem, therefore, where the human being, that is the woman, the organisms, and the products produced by the cells, especially lactic acid, come together to form an ecosystem that maintains the vagina in a healthy state. Therefore, when this healthy state or equilibrium is upstaged by disease or by other factors, and the vagina cannot defend itself anymore, then you have increased vaginal discharge. I like to repeat the fact that what I said earlier, that there are two types of vaginal discharge. The one that is harmless, which is basically contains secretions and cells, dead cells, and harmless organisms, and lactic acid. Now, at what times do we have? Does a woman, or may a woman have increase in vaginal discharge and would still be regarded as normal? Basically, like I said, there are physiological fluctuations in the production of normal secretions from the vagina, and this most people will notice that this happens around the time of menstruation, when a woman will normally feel wet, and this is because of the effect of the abundance of estrogen. And like I said the other time, that estrogen is what makes a woman unique. Then a woman may have increased vaginal discharge just in the later half of the cycle. That is in the earlier half of the cycle, in the proliferative phase, and during times of arousals or physiological excitements, like maybe before sexual intercourse. The glands, especially the glands of the Bartholin's, produce more secretions to lubricate the vagina. Also, when a woman is pregnant, there may be increase in normal vaginal discharge. So, aside from these times, anytime the vaginal discharge is copious and increased, and it becomes worrisome. So aside from the physiological discharge that we talked about, we also have times when, I should therefore say that what is a normal vaginal discharge? Therefore, a normal vaginal discharge, therefore, from what I have said, will mean a discharge that is moderate. It contains no harmful germs. It is whitish in color and does not have odor. That is, it does not have offensive odor. This is a normal vaginal discharge. It is moderate in quantity. It is fairly whitish in color. It does not contain harmful germs. And remember, I said one of the germs that is harmless and is most abundant in the vagina is the lactobacilli. Now, it does not also smell. So anytime, therefore, that a vaginal discharge appears copious, that is unusual in quantity, that is unusual increase in quantity, it smells, it has color associated, and some of them sometimes it may appear yellow or purulent, sometimes grayish white, sometimes it may be blood-stained. All these are hallmarks of an abnormal vaginal discharge. Now, what are the causes of abnormal vaginal discharge? And basically, when women talk of vaginal discharge, the taking intention is that it is the harmful vaginal discharge. That is the harmful type of vaginal discharge. Now, what are the factors that may cause increase in vaginal discharge? The first, I would say, divide this into, let's talk about lifestyles. I just said that the pubic hair that is in the private part traps organisms, bacteria, and even discharge, so that it forms a mesh to hold on to vaginal discharge and create an environment to increase such discharge. And this is more so because the private part is covered in part by fats of parts and muscles, that is of the hips, such that it is hidden. And because it is hidden, that area is usually wet and hot. And any wet and hot area most times would encourage the growth of harmful organisms, especially again that we have mesh of hair covering such an area in such a way that there's ample time for organisms to multiply and grow and stay and increase. So this is one aspect. So people who women who have tight underwears, nylon pants, cotton pants, and or sprays creams or smear creams on the vulva could form a medium. They could create a medium for organisms to thrive. That is one. The second is that there are times that women inadvertently, knowingly or unknowingly, insert objects into the vagina. And these objects vary from pant liners, pads, and even tight-fitting clothing, cotton wool. Some use, with due respect, some women still use paper wastes and all that. These are very unclean, and when they are inserted into the vagina, they cause increase in vaginal discharge. What I want to talk about today is about vaginal discharge and not vaginal infections, because that is a whole lot of, and when we get to cover that, we will be able to talk about specific diseases like gonorrhea and all other things, staphylococcus, vaginal yeast, and all that, or toilet infection. We'll still be talking about all those things. So, insertion of foreign bodies into the vagina can increase vaginal discharge. And this would also include things like family planning, like copper T and the likes. Aside from that, use of hormones can increase vaginal discharge. If a woman is on hormones, and hormones in this case would also include family planning tablets, that is family planning pills. Women who are on pills are more likely to have increase in vaginal discharge. Aside from that, like I said, anything that will upstage the ecosystem of the vagina, including reduced immunity or reduced fitness in the woman, may lead to increased vaginal discharge. This would include, therefore, disease conditions like diabetes, like HIV, or use of drugs like steroids, or people who are undergoing treatment for cancer and on chemo, that is drugs used for treatment of cancer. All these drugs may reduce the immunity of the woman and increase the the probability of abnormal or pathological vaginal discharge. Now, like I said, we are not discussing diseases here, but I must mention that one major issue in this part of the world is the issue of abortion. Women who have instrumentation, either because of abortion or because of other things, many of them are done in an inappropriate way and manner. This can lead to increase in vaginal discharge. Like I said, this is a very important topic. I know that most women would want to ask questions, but like I said, I wouldn't want to go into the details of the various infections. But I like to say that there are certain things that are associated with vaginal discharge which I should mention very briefly. The first is the irritation that comes with vaginal discharge. Yes, why do you have irritation and itching? Irritation because the discharge that comes out of the vagina has a lot of, that is the abnormal discharge that comes out of the vagina has a lot of components. Some of these components include, are the harmful organisms causing the discharge itself, hormones, lactic acid, glycogen, and some proteins. What happens is that when these come out, they are broken down, and there is production of other metabolites, including ammonia and the salts of ammonia. And this is an irritant to the skin, to most skins, or to skins of most women. And therefore, this causes itching. And so, this sets off a cascade of a cycle that will encourage further aggravation. That is to say, once this begins to itch, the tendency is that the woman will scratch, because in most cases, the scratching is sweet. And when you scratch, you cause bruise. That is, the skin of the vulva may be injured. And once they are injured, the germs can penetrate and then, gains ground and then begins to produce more vaginal discharge. So this is it. Secondly, like I said, many women unknowingly, after peeing, the urine comes out, and there's a time that the urine, trickles out, at the finishing end when it's about to finish. Now, these trickles of urine gets into the vulva and passes into the vagina, and then enhances the culture of harmful organisms. Again, women who clean from behind forward, that is, uses the tissue paper in such a way that they clean the anus after poo-pooing. They clean the anus from behind forward. Many people, or many of such, end up smearing the vagina, the vulva, with feces. Of course, when urine or feces or both of them come together, they form a veritable concussion or medium for growth of harmful organisms. And so all these things, these are ways that vaginal discharge becomes sustained. I should like to say that the sustainability also is hinged to the fact that most women have a menstrual have menstrual cycles. That is to say, these events may reoccur at intervals, which means that if this cycle is not broken, then vaginal discharge becomes as constant as possible, with probably no remissions or no reduction in quantity or other and other. Now, I must mention before I conclude that there are certain types of discharge that may worry a woman, and even though they do so, they don't really constitute a problem medically. Now, for example, there are times when the secretions of the vagina may be so great. I'm not saying vaginal discharge, I'm saying secretions may be so great as to wet the pants of women, constantly. Especially, like I said, those that are pregnant, those that are on oral contraception and all that. But they do not contain pathological organisms. That is to say, predominantly they contain probably lactobacilli. This type of discharge, when you go to a doctor and they examine you, they will now find, even though you complain of discharge, vaginal discharge, when the samples are taken, nothing will be found inside. This condition is called leukorrhea. It's a normal thing, but then it could embarrass. Another condition that could embarrass a woman, which is a very terrible condition, is, I talked about the ecosystem of the vagina. When for one reason or the other, for example, you use antibiotics wrongly, or use some drugs wrongly, and the drugs that you use end up killing harmless germs, leaving the tough ones behind. All right? It allows the tough ones, the harmful ones, to now predominate. That is, the population of the harmful organisms now increase greatly, such that the discharge is so great, it is so offensive in odor, and it is itchy and very troublesome. Such women may find it so worrisome even to go out. This type of condition is becoming commoner, and it is called bacterial vaginosis. It is caused by some organisms, which we are going to probably talk about in our next lecture. In our talk, when we'll be talking about specific infections, genital infections. So we'll still be talking about this type of condition. I think I would stop here and take some few questions. Yes. Can I have some questions, please? So it is time for me to take your questions. Please, you can post your questions so I can take them. But these questions should be specifically on vaginal discharge, so that we can discuss this topic as far as possible. Like I said, I am reserving the issue of genital infections, that is going to specific infections, till the next time, so that we can go deeper into this. But if there are questions on vaginal discharge, or how to avoid it, like I said, one way from what I've said to avoid vaginal discharge is to keep the private part clean, is to keep it dry, is to avoid antibiotics as much as possible except they are prescribed, is to avoid dipping objects into the vagina, including even family planning coils except they are prescribed, is to ensure that you are healthy in terms of the immune system. Like I said, if, for example, one has diabetes, you're likely to have more vaginal discharge, and you need to keep fit. If you are on steroids, or you have the HIV condition, these are things that may increase vaginal discharge, and they must be under the supervision and treatment of a doctor, preferably a gynecologist. Question: how can we control vaginal discharge? I think this is exactly what I just talked about. Keep the private parts clean and dry. When you engage in exercise, do not just spray the private part. Have a very clean shower. Dry up the private part with a clean dry towel. Avoid using antibiotics that are not prescribed. Avoid inserting objects. I know there are some prescriptions also that are prescribed for various reasons. For example, against contraception. There are some prescribed for fertility, and they are supposed to be dipped into the vagina. All these are wrong. All right. So these are ways to prevent vaginal discharge and to curtail it. Of course, if you already have vaginal discharge, you must see a doctor. The danger here, the most important point to note here, is that when vaginal discharge is pathological, or it is or the disease type, if whenever you see blood stain or it contains blood, you must not joke with it. This is a danger sign, and the doctor must be consulted immediately. Yes, can diabetes cause vaginal discharge? Yes, diabetes is a systemic illness that also has an immune depleting effect. So, like I said, when your immune system is reduced, the possibility of vaginal discharge being increased is high. So people with diabetes are likely to experience more frequent and severe vaginal discharge. Some women have foul-smelling vaginal discharge after menstruation. What causes this? Yes, I did say that around the time of menses, see, the menstruum, that is the thing that the woman passes out as menstruation, is a combination of the cells and the glands of the womb cavity that are dead, blood cells, red blood cells, white blood cells, the glands that are dead, then the secretion from the cervix, and then the secretions from the vagina itself, and all the organisms that inhabit the genital tract, that is the vagina, the cervix, and the womb. So during menstruation, the discharge will be increased, and aside from that, the integrity of the vagina, the vulva, that is the outside, the vagina, the cervix are compromised at this point, at this time, and that is why sexual intercourse is not advisable, because you can easily be bruised or injured. Aside from the fact that at this point, the penis can be regarded as a foreign body, which means that it can also aggravate vaginal discharge. And lest I forget, one reason for increase in vaginal discharge in our area is because of the sexual pattern that is rampant here. Any woman that is sexually active should expect to have a vaginal discharge to various degrees. But then it becomes worse when you have multiple partners, that is, multiple sexual partners. Or it could be aggravated when you change from one partner to another. So sexual intercourse is one factor that is important in preventing, in the causative consideration of vaginal discharge. So it is better to confine to one sexual partner that is infection free. And if peradventure there is infection, the two of you must be treated. I met someone who has never had vaginal discharge. Is that possible? Well, from what I have said, there is a thin line between vaginal secretion, which is harmless, and vaginal discharge. And you know that this is subject to personal interpretation. What I will call as a tolerable level of vaginal discharge may be seen as abnormal to other women. But by and large, women are entitled to have vaginal discharge at one point or the other in their lives. The fact is that when there is the disease type, not the normal type, when there is the disease type, it should be viewed seriously, and especially if you can identify blood stains, that is a clear indication that there is danger. Every vaginal discharge must be seen by a doctor and managed so that the consequences can be curtailed. We have had advices that it is good to wash the vagina with water alone and not soap. You can. Yes, this is called douching. Unfortunately, douching is one of the causes of increase in vaginal discharge. What it does, whether you use water or you use soap, is to wash out or clean out the harmless ones, which are the weaker ones, which do not really cause problems. Like, for example, when you wash the vagina, you wash out the lactobacilli. And these lactobacilli are the ones that produce the acid that protect the vagina from infection and diseases. So if you wash them out, then you leave behind the tough organisms that are disease causing. Therefore, people who douche often or regularly are likely to have more vaginal discharge, because what they do is to leave more harmful organisms behind that would increase vaginal discharge. And by the way, douching is not a family planning method, so it should not be done. On rare occasions, a doctor might prescribe washing the vagina with certain medications. That is an exception, but it should not be a practice that you should indulge in. Question: why does one have discharge and itching immediately after menstruation for the month, like 2 or 3 days after? So I said that menstruation, the period that the woman is menstruating, that is when the blood is coming out, it should be regarded as as a time when the vagina, the vulva, the vagina is weak in terms of integrity. And because what is coming out is a combination of cells from the various parts of the genital tract, from the womb cavity to the outside, that is the vulva, glandular secretions and organisms, germs. This and blood, red blood, white blood, and this now forms a concoction. And like when in the laboratory, when we want to grow an organism, we create an environment where these things are put, blood and the food that the germs will eat, and that is like the menstruum. That is the one that is coming out, is just like that. So it allows the growth of organisms. So at this very particular time, the woman is more prone to infection. The lining of the womb, of the vagina, the vulva, and the cervix are very weak, and therefore it is easier for disease to pass in through and fro. Even in terms of injury, the act of sexual intercourse can lead to bruising or lacerations and increase in vaginal discharge. So after the menstruation, there will be healing. Natural healing takes place, but it takes a few days. But before then, it is not advisable to have sexual intercourse. Like I said, this is a time that infections or sexually transmitted infections can easily take place. Thank you very much. I hope I've been able to answer. I know I cannot take all the questions, but I think I hope I've been able to answer most of the burning questions. Like I said, this is on vaginal discharge. We will get to talk about the diseases, that is the sexually transmitted infections of the vagina, the vulva, the womb, and all that, maybe in the next session. And then we can have more time to discuss further. This is another question, I think. What type of pant should a woman wear? Well, the pant should be loose. It should be thin. It should not be tight. It should be thin. It should not be tight. All right? And if you wear a pant and find out that you have irritation, is an indication that you may be reacting to the material of the pant is made of, maybe cotton or dye. For example, tie and dye. Dyes, women can react to dyes. If you react to that pant, you should please change it. Don't wear it. And then it is also a bad habit for women to wear pants that other people have worn. Whether you have cleaned or disinfected it or not, is not the case. There is a disease, when we get to talk about diseases of the vagina or genital tract, there are some organisms that you can contract by sharing wet towels. And this is responsible, this is very important in schools, where girls exchange towels in the bathrooms. When we get to that, we'll discuss about this. But what I've just said is that do not wear pants that are very tight, that are very that you react to. It is such that it should be such that it will aerate the private part, not making it wet, not making it too tight, not making it to be irritating. So that should be understandable. Can the type of underwear worn cause vaginal discharge? That is exactly what I've just said. The type of underwear you wear can increase your vaginal discharge. If it is too tight, that means that it comes in contact with your skin and it can cause irritation and friction. That will encourage growth of germs. Second, if it is too tight, it means it will retain heat, and germs love heat. If it is too tight, that means that you are likely to be sweating in the private part, and sweating is like petrol and fire. Sweating puts petrol on fire as regards vaginal discharge. That is to say that tightness, irritation, hotness would increase vaginal discharge. So the type of underwear that you put on can also influence whether you have vaginal discharge or not. Can PID also cause discharge, or is the discharge that causes PID discharge? PID is a disease of the cervix, the womb, the tubes, and the ovaries and its environment. But because the vagina is the gateway, the vagina that terminates at the vulva is the gateway to the inside of the genital tract. So whatever happens that needs to come out, will have to come out through the vagina. But PID causes vaginal discharge. It is not the other way around. All right? I mean to say that vaginal discharge is one of the complaints in women that have PID. So PID is the bigger disease. Vaginal discharge is a manifestation. Can aerobic bacteria causing discharge be treated with antibiotics? Yes, but they must be tested. The doctor must take a sample and subject it to and find out the type of antibiotics that will treat or will kill the bacteria. It is not good for women to believe that they can use any antibiotic. Maybe your friends used it and it cured her own vaginal discharge. That does not mean it's going to work for you. So you need to go see the doctor, especially the gynecologist, who will take sample, test it, and know which one is appropriate. Please don't indulge in self-medication. What is PID? I think I'm being drawn into diseases now, which I said we will discuss. We'll discuss later. PID means pelvic inflammatory disease, and like it says, it is pelvic. That is your waist. Your waist is inflamed. All right, and this, unfortunately, in the the definition of PID, it does not include the vagina. All right, the vagina is not part of it, even though, like I said, one of the manifestations is vaginal discharge. It's an infection of the cervix, the womb, the tube, the ovaries, and their environment. All right, that is PID. It's a very serious disease with very serious consequence. We will be discussing this in our subsequent meeting, and I hope that all of us will stay tuned. The takeaway here is that there are two types of vaginal discharge. One that conforms to the woman's body and function, which is called physiological discharge. The other one, and the discharge here does not contain harmful organisms when they are examined in the laboratory. But the one that we are talking about here is the disease type, which contains harmful organisms, which is copious, it has offensive odor, it has color. And like I said, despite the color, whenever there is blood, it's an indication that you must see a doctor. Of course, vaginal discharge is an indication that you must see a doctor so that you can be treated, to prevent the consequence. But whenever there is blood stain in the discharge, you just must see a doctor. Otherwise, there may be grave consequences. I thank you very much for listening, and I believe that we've had gained useful information. I look forward. If I have not answered your question, please, you can post on my Instagram page. I will try my very best to answer as many questions as possible. Our next topic, we deal in detail with genital infections, including pelvic inflammatory disease, that is PID. And I hope to see all of you. Please stay safe, and God bless you all.